Hello everybody, we're here today with Judy Ogborn, one of my favorite patients here, who joined us about 3 months ago with our Peripheral Neuropathy Program. And she actually started with her husband Carl. In fact, Carl was the one who started the program, and it was during his evaluation where I was trying to show what a normal foot should feel like. We actually discovered on you that your feet weren't actually up to par and the nerves weren't working very well in the feet either. So we discovered, whoa, you have some peripheral neuropathies as well. But Judy's going to tell us about, if you wouldn't mind, tell us about your experience with our Peripheral Neuropathy Program and then some of the other things you've experienced. It is a phenomenal story. So, Judy?
Well, that was a surprise. I didn't realize that I had peripheral neuropathy. But I was suffering from some other issues that I thought had nothing to do with the program. But we attended a seminar and learned about it, and I got to thinking about it. I've always been interested in proper nutrition, and certainly know the value of that. But I've suffered from a pain that nobody could diagnose. I've gone from doctor to doctor over the years, I mean many years.
Yeah.
Nobody could identify what was wrong. And we've tested and tested and tested, and I know what it's negative for.
Yeah.
A whole laundry list of things that it's
Right.
not, but what it is, nobody seemed to know.
What was that? What was that symptom? Can you share that with us?
Well, it was a sharp pain in my abdomen that would occur almost every time we went to the market and were walking around. Walk, stop, walk, stop.
Yeah.
The pain would come in my lower abdomen, always in the exact same spot, and I'd have to sit down to relieve it. If I didn't sit down, if there was nowhere to sit or rest, I actually got physically sick at my stomach and felt faint. It was quite a serious symptom.
Yeah.
The miracle is I've found relief from it through education, through the program. I did the cleanse. What again is the?
Yeah, it's a 6-week to an 8-week cleanse called the Repair Bite and the Clear
Repair
Bite
Bite.
cleanse.
Clear
Right.
Bite. Yes.
Right.
Yes, it started feeling better after that, and a nice side effect to that was I've lost 11 pounds. Feel very much better, and I haven't had a pain in, I've lost count how many weeks now. It's that good.
6 to 8 weeks, 9 weeks maybe?
Probably 9 weeks
Yeah,
by now.
yeah, that's great.
Yeah,
That's
yeah.
great.
And I've tested it out. I mean,
Yeah.
I know it's going to hurt any minute now, and it didn't.
Oh,
and
you're done.
yeah.
What do you think that was? What was the cause of that, do you think?
Well, I know what it is now.
Okay.
Because I've tested the theory out.
Right.
And I was tested for gluten sensitivity, and along with many other things. But the gluten sensitivity was found, as well as a sensitivity to dairy products. And on reducing the amount of that, cutting it out almost completely, the best that I could, I felt relief. And when I slipped up and ate something that I knew had gluten in it, because I just needed a biscuit or something like that, I felt almost an immediate effect from it.
Wow. Yeah.
And that effect was my eczema.
Oh.
Yeah.
I forgot about that. Yeah, tell us about your eczema.
I've had eczema since
right.
I was a baby.
Wow.
And it was quite bad at times. Scaliness, redness, rash, it come and go. And after cutting the gluten and the dairy out of my diet, my eczema was almost completely gone. And then I had a few things that had gluten in it, knowingly, because I just was testing.
Sure.
And it got scaly and itchy and flaky around my ears again. Like, oh yeah, this is proof. To me, that's proof.
You ran a test.
I did. I did.
Wow.
And I'm convinced that,
That's
that
good.
there's certainly a direct effect.
Now, you didn't really have any burning or tingling or pain foot. We noticed in the exam that you had quite a bit of numbness and you weren't feeling your feet. Anything you'd care to share about how your feet have been doing that you've noticed?
I haven't truly noticed any difference in my feet, but
You didn't have any problems that you knew of to begin with?
no, I was not aware that I had
Okay.
peripheral neuropathy.
Right.
In fact, I was shocked, like, what? How can that be? But I would feel the test on one side and the exact same test on the other, and it was numb. And I
Yeah.
wasn't feeling it. But I noticed my balance is better,
Yeah. There you go.
and, well, I've reaped a lot of rewards from the
Good.
program.
Good.
I think that the orthotics in my shoes are helping with my posture. I'm sure it is. With
Yeah.
I've always had horrible posture.
Yeah.
And the arch support and all, I can see my legs are straightening out better.
Yep. Good.
Hips don't hurt as bad when I sleep at
Good.
night.
And so we know that balance has a lot to do with feeling your feet. So although you weren't feeling any pain per se in your feet, having more, your brain having more awareness of where your feet are is what's contributing to your improvement in balance. It's all connected.
It's gotta be.
Yep.
Yeah.
Any recommendations for folks who are looking at this right now and thinking, I'm not sure about that program?
I would say look into it, study it, think about it, and go for it. If you have these symptoms and you're suffering from any of these conditions, especially that peripheral neuropathy, because my husband suffers badly from that, and he's tried everything. He's getting relief from some of the products that you recommended, and,
Yep.
and he's using faithfully. But
He's off his medications last time I checked.
Yes, he had to take a little bit lately, a half a pill, but yeah, absolutely. He was
Okay.
up to 2 of those.
Yeah. So he's
Depending
better.
on
We got
Carl.
some more. Still got some work with Carl to do, but he's
Yeah.
better. Good.
Oh yeah,
All
he
right.
is very much better.
Well, thank you for your time. I really appreciate it. And for those of you who are listening, hopefully you gained some good, valuable information from a real live patient of mine. Appreciate it.